to keep in mind. So the purpose of this course, unlike many courses, I hope you walk away with this course feeling that I've taken the responsibility, the burden on my shoulders to help make you guys better. And I want you to think like I do. And I want you to feel that you're not intimidated by anything. Whatever I know, I'm going to try to teach you. I'm not going to hold back any secrets. I'll tell you all the tricks I know, so that when you walk away, you can actually do imaging better. And the analogy I give is, my technologists in San Francisco have gone to a physics course by Manny Canal. And Manny Canal is like a great radiologist in Pittsburgh. And he'll lecture on physics, and he'll wave his arms, and he'll do T1, T2 decay. But then my technologists come back, and they still can't scan it better. And so that's not what you want. You don't want to go to a course that you learn all the theoretical aspects, whether it be collagen or chondrocytes or shear forces, and then go back to your practice and realize you still can't read cases with a higher accuracy. So that's what we don't want to do. What I want to do is I want to make you guys better radiologists. And so by doing all the lectures myself and giving you complete continuity, obviously you've trusted me because you're here. So giving you that continuity, I think, in my opinion, is the most valuable part of this program. Now the other thing that's valuable here is I'm going to throw a lot of information at you over the next 2.5 days. And I don't want you to feel overwhelmed with the amount of information. And so in a second I'll ask everyone what their level is. But the most important thing to take away is how I look at a case, what my approach is. In other words, do you have a method to dismantle a case so that within a matter of seconds you can go through a checklist and you can read a case knowing exactly what you're looking for and not waste your time looking for things that are not important. So that if your colleague stood next to you, an orthopedic surgeon for instance, and asked you to go over a case, you can't say, well, excuse me, I'm going to go to my office for 5 minutes and I'm going to look at this case and I'm going to come back and we'll go over it together. You can't do that. And oftentimes in high-profile cases, if you have a professional athlete, they'll have their nutritionist, their psychologist, their sports agent, their orthopedic surgeon. They'll have this whole entourage with them. And they're standing behind you asking you what you think about the case. And you have about, I would say, maybe 5 or 6 seconds, and you got to start talking. And so if you don't talk in 5 or 6 seconds, they're going to assume you don't know what you're talking about. So that means within 5 seconds, you sort of have to have a method that gives you enough confidence that you know what's wrong with the case, and then as you're talking, you can go through the rest of the case. So how you look at a case, how you read each of the joints that we're going to go through, that's the most important thing that you can take away. All the academic information that I'm going to give you, and it's a lot, is also important, but not as important as can you systematically go through a case more efficiently and faster than anyone else. And the other thing I want to emphasize is the style, the manner in which you express yourself in a written report and verbally too. So before I start the shoulder section, I have these little short lectures that I want to talk to about how to dictate a case. Because when I teach fellows how to look at a case, I always say don't use words like appears, or don't use words like I'm thinking of, or don't use words like I'm wondering if, or don't use words like probable. And sometimes you'll see in one sentence, you'll see them all. They'll say,